my name is Tara Talbot, and this is my assistant Dave and my dog Saber. I'm going to go through this very long list of anatomical features on him. I'll start with his skull. Good boy. So, I have the incisive bone, which is where the incisors connect. I have the nasal bone here. Maxilla is the upper jaw. Mandible is the lower jaw. I have the frontal bone, parietal bones, occipital at the very back of the skull where the atlas and axis join. The external auditory meatus is where the ear canals go through, in behind the temporomandibular joint, which is where the maxilla and mandible join. Where else? Frontal sinuses would be here. That's where horns appear in cattle and goats. Good boy. Oh, so this is the body of the mandible, the long horizontal point. And then we have the ramus, which is the point that goes upwards and connects with the maxilla. The occipital bone, again at the back of the skull. The nasal turbinate would be into the nasal bone above the incisive bone. And that's for helping keep air moist and humid when going into the lungs. And then we'll get into the vertebrae and ribs. Good boy, stand up. Give him a treat. Good boy. So we have the cervical spine. There's 7 of them. There's 2 specialized ones. We have the atlas, which connects with the occipital bone to form a joint, and we have the axis. Then we get into the thoracic. So to palpate the transverse and dorsal spinous process, the dorsal spinous process is what you can feel. It's the spine coming up off the vertebrae, and you can feel that along the back. For the transverse, those are the wings going off the side of the vertebrae. Then we get into the lumbar. 7 cervical, 13 thoracic, 7 lumbar, because there's 13 ribs. Dorsal pelvic. So then I have the sacral, which there's 3, and they're all fused together, form part of the pelvis. And then the coccygeal. Who knows how many he has, but he has a very lovely tail. Then he has all of his ribs here. His sternum goes along the chest here. So at the very top is the manubrium, and down at the very bottom is the xiphoid process. It's where you do CPR on a human. The costochondral junction is the cartilage in between, at the very end of the ribs, between the sternum and the ribs, where the ribs connect to the sternum. Yep, 13 ribs in a dog and a cat. So now we'll go into thoracic limbs, which are the front limbs. Good boy. So we have his scapula here, nice big triangle going down to his humerus. And you can feel in a poorly muscularized animal the spine a lot easier, but his spine of the scapula is there going down to the humerus. This is the lateral aspect in this video that we're seeing. So then we have the humerus here, and this would be the greater tubercle. And then we have the radius and ulna here. The radius is the weight-bearing bone at the front of the limb, and the ulna is at the back. And we have the olecranon process, the elbow. Then we get down into his little carpus. So this here, his wrist, and metacarpal bones going down to his paw. And then we have his digits. Hey, so you can sit. Good boy. Treat. Oh, good boy. So they have 5 digits in the front, starting with digit 1 is the most medial, 2, 3, 4, 5, the most lateral. And they have 3 phalanges, sorry. 1 being proximal to the body, so closest to the body, P2 in the middle, and then P3 is the furthest away. Good boy. Now we'll do the pelvis. Good boy. So we'll have the ilium. You can feel the wing of the ilium up top here. It's a lot easier to see in short-haired dogs, but you can feel it there. It goes down, it connects to the pubis, which is more intermedial. And then we get down to the ischium, which is that pubic bone that, not the pubis, but part of the pubic bone. You can feel it right next to his anal glands. Nice bony process there. So those 3 bones, the ilium, ischium, and the pubis, form the acetabellum, which is where the femur head connects into and forms that joint. The ischial tuberosity is that bony point next to his anal glands. And then we have the obturator foramen. Obturator. It's those holes that you see in the pelvis. Looks like it should be a joint, but there's actually nerves and blood vessels running through there. Then we have the femur. So head of the femur going down. Again, this is the lateral right side. We have the greater trochanter, which is the opposite of where the head of the femur is, going into the pubis. So it's the bony part coming out that you can sometimes feel. It's not very well. He's very muscular under all this fluff. Yeah, and the head of the femur is going into the acetabellum of the pelvis bone. Then we go down and we have his little patella. He doesn't have any luxating patellas, so it's in there nice and solid. And then we go down to the tibia fibia. The tibia is at the front and is the most weight bearing, and then the fibia is a little thinner bone at the back. So we have the tibial tuberosity, which helps where the knee joint connects. And then we have the tibial crest just below there. It's kind of like a spine. And we get into the tarsus here, and the calcaneus, or the hock. Boop, right there. Metatarsal bones, there's only 4 in the hind feet of most dogs. Some have loose or bony hind limb dew claws, in which case that would be a digit number 1. However, there's only 4 in him, so we have 1, the most medial, 2, 3, 4 being the most lateral. Again, this is all the lateral right side that we're displaying here. And now I'm going to palpate for the lymph nodes. So I have the parotid, which is kind of behind the temporomandibular joint. We have the submandibular, which is under his mandible. It's listed as mandibular there, but I learned it as submandibular. Popliteal, those are at the back of his knees. So behind the stifle, sorry. Then we also have inguinal, so in his groin area. We have axillary under his elbows. Sorry, his armpits, not his elbows. And then we have prescapulars. So they are just in front of his scapula here. And that's the end of my video. He's a good boy. You see?